Good day! I am Dr. Wilfredo S. Tagle, urologist, and welcome to this week's episode of Medical PracTIPS, a series of tips and tricks to help you start your medical practice. For this episode, it is about Article 4 of the Code of Ethics of Physicians, entitled The Professional Responsibilities to the Healthcare System. So, get ready, sit back and relax as we start this episode of Medical PracTIPS. The first responsibility of the physicians is improving quality care. That means the physician shall be dedicated to continuous improvement in quality of healthcare. You have to maintain clinical competence by lifelong studies, collaborative working with other professionals for patients' safety, optimized outcomes of care, and proper health care resources use. Then, physicians must have an active participation in development and application of better measures of quality of care. Physicians should always look for a lifelong studies. Ibig sabihin, lagi siyang mag-aaral. They have to attend conferences and other lectures to improve their knowledge in treating the patients. And of course, the main goal is for the improving quality of life of their patients. Okay? Next, for Article 4, Section 2 of the Code of Ethics, physicians should contribute to improving access to equitable health care by providing appropriate medical services within different levels of healthcare system, either in public or in private services. For Article 4, Section 3, the cost-effective management of limited healthcare resources. The physician should place paramount consideration on the cost of diagnostic tests, procedures, treatment, and management of their patients. Avoid superfluous tests and procedures which can expose your patients to possible harm, additional expenses, and inappropriate utilization of limited resources. That means bawasan nyo ang gastos ng inyong pasyente. Kung hindi na naman kailangan, huwag nyo nang sundin yung dekahon na requirements. Or, kung maaari lang, tipirin nyo ang diagnostics and treatment ng inyong pasyente. That's it. Now, for Article 4, Section 4 of the Code of Ethics, it is all about research. All research should obtain approval of Institutional Review Board and its Ethics Board. Conducting any form of research, dapat lahat yan dadaan sa ethics boards and review boards. They must operate in accordance with the national or local regulations and international council or harmonizations of good clinical practice. Importante po yan, yung good clinical practice. Then, the physicians participating as a principal investigator shall exercise full disclosure and ensure participants are well informed about the research. It's the differences between the physicians and patients' relationship in clinical practice and patients' participation in any form of research. That means talagang i-explain mo detalye sa pasyente na sila ay kasama sa research, kung ano ang mangyayari and possible na mangyayari. And of course, they have to agree. You have to have a consent, a signed consent, informed consent. And lahat ay ito ay papa-approvean sa review board and especially sa ethics. You have to abide by all clinical standards, regulations, and international and local standards. Okay? That's it for today's episode of Medical PracTIPS. Tune in every Wednesday at 7 p.m. for the latest episode of Medical PracTIPS.